Those who work in cancer care say finding a way to deal with cases like this is an increasing necessity.
It is pretty difficult for the healthcare staff to be faced with someone who absolutely refuses a treatment that you're pretty sure will be not just helpful but life-saving, like in this case. This is a patient who everybody involved in her care will remember for all of their careers. It's such a desperately sad story.
Paloma Shemirani was 22 years old when she was diagnosed with non-Hodgkin's lymphoma. Had she pursued chemotherapy, she would have had an 80% chance of survival. But her mother, who had been a nurse until she was removed from that post for spreading disinformation related to the COVID pandemic, essentially influenced her to not pursue chemotherapy, but also seemingly convinced her that maybe she didn't even have cancer. And so instead of pursuing a treatment that again would have had a high rate of cure for her, she pursued dietary treatments and coffee enemas. She even refused to have follow-up imaging because she was concerned about the impacts of radiation. Harm from radiation shows up many years later. When you have an accumulation of radiation in particular, then maybe years down the line, you might develop a tumor. She was dead 7 months after her diagnosis, and she was worried about the impact of radiation, which could have actually, a CT scan could have shown her that her tumor, she had a mediastinal tumor on the right side of her chest, that it was growing, and it was in fact impeding the circulation of blood in her body, and ultimately it ended up closing off her airway, and she collapsed at her home. For reasons that are totally unclear, her mother called a friend rather than calling an ambulance. And so for some period of time, over 30 minutes, she was doing CPR or some version of it. It's really hard to know what exactly was happening. But when they got a pulse oximeter on her to see how much oxygen she had in her blood, it read 36, which means she was not getting adequate oxygen flow to her tissues, to her organs, to her brain. A normal pulse oximeter reading is greater than 92. So when she was taken to the hospital after the paramedics had arrived, she was found to be brain dead and passed away a few days later. Her brother Gabriel had pursued a court hearing to try to convince her, Paloma, while she was still alive, to pursue medical treatment. According to the coroner's report, their mom did have an influential role in preventing Paloma from seeking appropriate medical care. This is why so many of us are disturbed by the lies told by these so-called wellness influencers who have these videos that go viral telling you that things like baking soda are going to cure your cancer and that you shouldn't get colonoscopies or mammograms, because we see the actual harm that comes to people when they eventually do need medical care, which is exactly what happened in Paloma's case, although it was far too late for anyone to help her.
I want to get justice for my sister and my mum to be held to account, and I want my mum being held to account to make the government and the state realise we need to stop stuff like this happening again. So I don't want my sister to be one in a long line of people that die this way.